Healthcare System in the Netherlands by Paula Cárdenas, Natalia Dávalos, and Paola Fernández. Healthcare, by definition, is the maintaining and restoration of health by prevention and treatment of diseases, especially by trained and licensed professionals. It is a set of efforts made to achieve this in the physical, mental, and emotional fields to ensure the well-being of the population. Although it is often defined as the management and treatment of any health problem through all goods and services produced to improve your health. As anyone would take into account, it's one of the most important components of society. The Netherlands topped the list of the 35 countries in the 2016 EuroHealth Consumer Index for the best health services, and is the only country to consistently place within the top 3 spots since 2005. Healthcare is mandatory in the Netherlands. That is why all of its residents are required to purchase health insurance, even if said residence is temporary. People can choose among the available insurers, but often get insurance through their employer. Insurance can be provided by private insurers, creating business competition among them. These insurers can be profit or non-profit, but either way, they are tightly regulated by the federal government. Also, they are obliged to accept any resident in their coverage area, regardless any previous condition. Anyone who wishes to apply for healthcare will first be assessed by the government to determine which services will best fit their needs. The current system was created through a health policy in 2006, and Netherlands spends more than 10% of its GDP on health. The government provides even more resources for the elderly, people with severe diseases, and with pre-existing conditions. People with low income can also apply for tax credits so they can purchase their insurance. People under age 18 in the Netherlands are insured at no cost. This happens because they don't necessarily have to take out their own health insurance. They can be covered under their parents' health insurance. This, however, does not happen automatically. Parents first have to inform their insurer that they want to assign their children to their health insurance. If they don't take out insurance, they can risk a fine. As it was already said, people often get their insurance because of their job, but the Netherlands has a separate universal national social insurance program for long-term care, known as the AWBC or Exceptional Medical Expenses Act, that is available for every person who does not have this condition. In this way, the public insurance part is actually covered through private insurance, through the government regulating private insurers. Netherlands has a strong system of high-quality general practitioners, as a success in keeping costs down. It also has a large degree of choice for consumers that provides access for everybody. As a result, people are not left out of the system, and it does achieve a good outcome in the end. Healthcare in the Netherlands can be divided in 3 different ways. The first one is in 3 different echelons, which are different levels. The second one is somatic versus mental healthcare, which is the physical aspect versus the mental aspect. And the third one is cure versus care, which is short-term concerns versus long-term concerns. Also, we can find 3 types of hospitals in the Netherlands. First are the university hospitals, then are the general hospitals, and a category in between of them that it calls itself top clinical teaching hospitals. There are 8 university hospitals, which are the largest hospitals in the country, and they have the largest number and greatest variety of specialists and researchers working on them. The basic insurance package covers all costs for the most common medical care. The government is the one to decide every year what will be included in the list. The 2017 basic health coverage in the Netherlands includes general practitioners' consultations, treatments from specialists and hospital care, maternity care and midwives, certain mental health care, medication, dental care and physiotherapy up to 18 years, care from certain therapists, such as speech therapists, dietary advice, basic mental health services, and stop smoking programs. Insurers offer a choice of policies at a range of costs. In some of the plans, the insurer negotiates and contracts with the health provider, while more costly plans allow patients to choose their health provider and be reimbursed by the insurer. Most people also purchase additional private health insurance for services not covered, often from the insurer providing the basic coverage. It is possible, however, to purchase the additional coverage from a different insurer than your basic insurer. This may make things more complicated when processing bills, but it can sometimes lower your overall costs and allow you to purchase additional coverage tailored for the needs of international people residing in the Netherlands. As for the financing, government expenditure on health in the Netherlands made up to 80% of health spending there in 2006, according to the World Health Organization. The required standard insurance is financed by a mixture of income-related contributions and flat premiums. The individual contribution is set of 6.5% of income, which is contributed by employers if the patient is enrolled through their job or by the patient if they are self-employed or unemployed. It's a sort of tax. The insured also pay a flat rate premium to their insurer for a policy. Everyone with the same policy pays the same premium, and lower income residents receive a health care allowance from the government to help make payments. In this way, everyone will be able to get their health insurance.